Health experts are worried about three sicknesses, slamming them all at once. They say it's shaping up to be a rough winter. Flu season is starting unusually early and harsh. Children's hospitals are packed with another respiratory illness called RSV, and COVID cases are expected again to rise with holiday gatherings. Now, with only so many hospital beds available, a Des Moines Metro Hospital is reworking their plan for when and if they reach capacity. Local 5's Khalil Maycock reports.
An early start to kids getting sick with respiratory syncytial virus or RSV, now coupled with a rise in the flu and new COVID variants.
It is a legitimate concern and fear.
Dr. Akinbode Egbelakin with MercyOne says this winter is shaping up to look like one that could be a triple-demic. He says the reason this winter has the potential to be severe is because during the last 2 years, people wore masks and social distanced, preventing them from spreading certain viruses and gaining the natural immunity. That doctor says this could lead to more people being admitted to the hospital like we're seeing now with RSV. To make sure his hospital is prepared for the worst, they're revising their plan that details how to handle anticipated increases in patients.
We are currently working on a surge plan to absorb all these patients and provide the care safely that they need when that does happen, or if it does happen.
He says the last time his hospital had to use a surge plan was back in 2021. Local 5 reached out to Broadlawns and Unity Point to find out when was their last time using a surge plan and if they'll be updating it. Unity Point says they last used their surge plan in 2021 and have updated it. And Broadlawn says the last time theirs was updated was December of last year and have not had to use it. And Dr. Egbelakin says another thing that does worry him as his hospital prepares for the winter season is the hospital staff not being enough.
There's a constant meeting that is being held on management level to make sure that we are prepared if this does happen at our doorstep.
And I did reach out to the other hospitals and ask about their staffing levels and if they had enough people if a surge happened. Both say more could always be helpful. Broadlawns has nearly 200 doctors and physicians assistants, while Unity Point has a little over 630, which they say is good enough for right now.
Khalil, thank you so much for that. CDC numbers and graphs show RSV cases keep rising in Iowa. Here's the 5-week average for detections. These lines show different methods to determine if someone has RSV or not, and both are moving upward. Meanwhile, here's a look at flu activity in the states through last week. This CDC data shows orange, red, and purple states with high or very high activity. Now, Iowa's flu activity is still classified as minimum.